All right.
Okay. So I'm the second negative speaker, and first off, I wanted to address the abortion rate statistics that they have, and I was actually looking into that research as well, and the reason that our country has a higher abortion rate is because we have more medical technology, we have higher medical treatments, and because of that, we can carry more pregnancies to term, whereas in other countries, they aren't as medically advanced, so their babies don't even make it to term for abortion. So because of that, that's why we have more infant mortality rates. In European countries such as the UK, which is a socialized medicine country, in order for a baby to be counted as an infant mortality rate, it has to weigh 1 pound and be the length of a foot. So sorry, we're not judgmental on the babies. Also, it's not working in Canada. A National Pulse on Health survey resulted in 80% of Canadians wanted a major healthcare reform, which is what we're going through right now. So obviously they're not liking it. They don't like it because although they're paying all these taxes, they're not getting all the benefits that they're supposedly paying for. Their socialized medicine doesn't include pharmaceuticals, like medicine that you need every day. It doesn't include many surgeries, which you need. You can't really control that. It doesn't include dentistry, home care, or chiropractic services. And if gene therapy were allowed to, say, fix paralysis, that would not be covered either. So they would not be matched up with the U.S. as far as medical advancements. Just some comparisons, because they do not have quality health care there, the average wait time for the emergency room in the United States is 38 minutes to an hour. In Canada, it's 20 hours and 42 minutes. So I think I'd rather take paying a little more to get that. Not only that, but to wait to schedule a surgery, the recommended time is 4.7 weeks, but in Canada, you have to wait 11.3 weeks. For neurosurgery, the recommended time is 5.8 weeks, but over there, the average wait time is 31.7 weeks. And for orthopedic surgery, the recommended wait time is 11 weeks, and for over there in Canada, you have to wait 36.7 weeks. So you have to wait a long time for your health care to even come around. And many times, they do not even cover it. You have to hire a private sector to do it for you, and then you have to, or a private clinic, excuse me, and then you just sue the government to pay you back. Another comparison is currently the amount of people in Canada waiting for cancer treatment is 827,429 people waiting just to even see a specialist to determine what kind of cancer they have. And in the UK, it is 1.8 million that are waiting for a hospital admission. That's just to see a doctor, 1.8 million. Not only that, but we have more access to medical technology because we open up the science part of it, whereas over there they don't have enough funding for it. So just to put it in perspective, CT scans and MRI scans, which most of you have probably heard of, they're kind of the leading technology to let you know if you have a brain tumor or cancer or some other disease. In America, we have 34 per million for CT scanners, and for MRI scanners, we have 27 per million people. In Canada, they have 12 CT scanners per million and 6 MRI per million. Not only that, but why do we need to change when we just reformed it with Obama? There's nothing wrong with Obama's health care plan. In fact, it helps jobs here. It's going to generate more jobs. In Canada, there's less of an incentive to be a doctor because it's government pay. Government pay, as most of us have heard, isn't as great if you compared it to a private clinic's pay. They have more motivation, and also under Obama's new health care plan, doctors will be paid, they'll have higher salaries based on their quality, not on the volume of people they serve. So if they do better work, then they will be paid more, and not necessarily just by how many people they work on, how it is in Canada. Not only that, but the Affordable Care Act just passed on September 23rd of this year. It covers preventative services. There's no co-pays or deductibles for child preventative care, and you can choose your own doctor. And not only that, but the seniors right now are the baby boomers, so they're the big generation, and they get rebate checks and 50% off all their drugs, and all of them, need their drugs. Not only that, but if we did switch to that, So many people would lose their jobs, like the insurance companies, administrative staff in hospitals, clinics, and nursing homes. The unemployment right now is at 9.6%. Imagine how much higher it would go in that. And for all those people that did lose their jobs, they'd have to be replaced and retrained in different programs, and that can cost an estimated $20 billion just to do that. So as of right now, we have everything set in place for what we need, so there's no need to change it.